We're going to get through this. We're going to get through this together. And we are living through historic times. It actually seems like a lot of history is all happening at the same time. We're in the midst of a 1 in every 100-year worldwide health pandemic, the likes of which most everyone alive has never seen. We're at a time where we are seeing widespread calls for ending racism, creating true equality, and ensuring justice is available to all. Seeing marches, activity, in many places we have never seen it before, with a lot of our next generation calling for the better world that we were supposed to have created many generations ago. I was listening to one U.S. Senator talk this weekend. He says, we have to be courageous in our compassion. And I thought about that a little bit because we've been talking about compassion a lot in Kentucky related to the coronavirus. It's why we have ensured that we have been healthy at home. It's why we've lit up our homes and places of business and all types of facilities green, more so in unity and compassion than I think I've ever seen in this state. Well, it's going to take that same type of compassion for our fellow human being, recognizing and understanding that we still have systematic racism in just about every part of our society, and using that same compassion to say it's unacceptable and it's time for it to change. The marches that have been going on in Louisville, certainly the last several nights, if not more, have been very, very peaceful. Because of that, neither the KSP nor the National Guard are stationed in Louisville any longer. The KSP ended its engagement Saturday, and the Guard had only been on standby for a number of days. And while those units are no longer stationed in Louisville, the calls for justice obviously continue, and we need to listen. So today, we're going to talk about efforts that this administration is going to take to create equality and to start addressing some of the systematic racism that's existed in our healthcare system, in our law enforcement training, and in our system of public education. I'm going to start with healthcare. Michael Brown's going to talk about training, and our Lieutenant Governor is going to talk about education and workforce development. We're then going to go over the numbers. Secretary Freelander is going to talk about long-term care and pandemic EBT. But let me first start with, in our healthcare system, the inequalities have been laid bare, have been exposed by this COVID-19 epidemic, and the results of inequality in healthcare have been shown. It's death. By allowing this type of inequality to exist for as long as it has, we see African Americans dying at twice the rate that they make up of the population. And it simply can't be allowed to continue any longer, and it shouldn't have taken this type of pandemic, or it shouldn't have taken these types of demonstrations for us to commit to ending it. Now, it's going to take a number of steps, ones of coverage, ones of access, and ones of quality. Well, today, I'm going to make a commitment on coverage. I believe that healthcare is a basic human right, and I talked even when I was running about how I wanted everybody to have some form of healthcare coverage. Well, as I've been listening and I've been trying to hear what those have been giving voice on in inequality is saying it's time for prioritization in Black and African American communities, so we are going to do that. My commitment today is we are going to begin an effort to cover 100% of our individuals in our Black and African American communities. Everybody. We're going to be putting dollars behind it. We're going to have a multifaceted campaign to do it. But it's time, especially during COVID-19, when we see what happens when you don't have coverage, we're going to make sure that everybody does. This is just a first commitment in making up for that inequality that Dr. King said was one of the most severe, and that's inequality in healthcare. Again, I want to eventually make sure that there's coverage for everybody out there, but this is the time, this is our commitment, and we're going to make it happen. Next commitment is in the area of law enforcement and law enforcement training. I'm going to ask Michael Brown to address that.
Thank you, Governor. One of the situations created by our response to COVID is that we had to suspend both our cadet classes at our Department of Criminal Justice training, as well as most of our training that's called in-service. And Kentucky has one of the highest requirements in the country for officer training, and it's served us very well. But we've had to suspend that, and we are now, as we reopen other parts of government and other parts of our economy, we're going to get back to that training. It now provides us with a very distinct opportunity. And if, James, you could put up the slide. While we don't expect that we'll be able to get 40 hours of in-service training for all of our officers this calendar year, we are committed to get at least 8 hours of training for all of our officers in the remainder of the calendar year. And we are going to focus on some very specific topics and also some very timely topics, some of which are self-explanatory as you look at them. Others are not so explanatory, and ones that even I'm going to delve into and actually hope to go through some of the training. Implicit bias, we know that's something that we all have. Use of force, and I don't want to simplify this, because sometimes use of force in the past has been marginalized into more or less a how. And we trained officers on how to do it. Well, we're going to focus a lot more on the when and the why and the what. And that's going to include both deadly and also use of force that can turn deadly. We know about guns, but there are other implements, physical tactics that we need to review. Civil rights laws. If any of you have been through a course on carrying a concealed weapon, you know part of the focus of that course was to tell you, well, you know, what your responsibilities were. Well, I think this is something that's worthy of refresher course for all of our officers. Ethics between departments, between governments, between officers themselves, and of course between the communities that we serve. Emotional intelligence. I don't know that much about that, so I guess I'm going to take the course along with many of our officers. But clearly, all of us come to work and we get up in the morning. If we carry those emotions, those feelings with us, it can affect how we operate during that day. And then, of course, community relationships. With Commissioner Gilak and DOCJT, and along with the Kentucky Law Enforcement Council, we're going to work on adding flesh to these topics and roll this out for the remainder of our calendar year. Thank you.
Secretary Brown will also be providing an update on the David McAtee investigation at tomorrow's 4 o'clock. We are still awaiting on some information to come back that's necessary to put the update that he's going to provide in full context. So we've talked about health care, where just the first of many commitments we're going to make is 100% coverage in our Black and African American communities, and that's going to require reaching out. It's going to require things that look very similar to connectors that we used to have to sign up people all around this state, and it's going to be investing in community partners that are already within those communities to help. No one knows those communities like those foundational partners, and we're going to ensure that they are a big part of that. You heard about law enforcement training, where this will be the most significant set of training. I believe right now, in last year's set of training, I wasn't governor last year, well, except for a month. There was only one course that I'm aware of. It was called Cultural Awareness, and it was only for dispatchers. So this will be a significant step that will apply to the majority of law enforcement throughout this Commonwealth. And next is in education, where we still see significant inequality in results, and where far too many of our schools have educators that look like their students. So I'll ask our Lieutenant Governor and Education and Workforce Development Cabinet Secretary to address that.
Thank you, Governor, and good evening, Team Kentucky. As we have seen over the past few weeks, our society has been crying out for change. As I look out into the crowds of people that you see on television and in our communities, I notice that most of them are young people. And as a teacher, I'm proud that we have so many of our young people engaged in the peaceful process and demanding that we, as their elected officials, enact positive change in their communities. Let me be clear. Public education was made to meet this moment. At last week's Kentucky Board of Education meeting, I proposed 3 immediate changes that I believe will encourage a more complete representation from groups of people often overlooked in the educational process. The first was to appoint a non-voting member to the board that is a current student. When Governor Beshear added an active teacher as an ex officio member for the first time, it was the first time that has ever happened. And so by adding a current student to the Board of Education, this ensures that every group in public education has a seat at the table as we talk about the future of public education in Kentucky. The second was to implement statewide implicit bias training for all school faculty and staff. The issue of bias that all of us harbor is something we must confront, especially if that bias hinders our opportunities for our children. And third, we want to develop new strategies and programs to recruit more persons of color into the field of teaching. For many of our kids, the first leaders outside of their home are their teachers. Kentucky's kids of color deserve to see themselves reflected in their community leaders. And all of our children are better prepared for their future when exposed to a diverse community of leaders and teachers. At the end of the year, test scores are higher for Black students who have teachers who look like themselves. Black students who have just one Black teacher by 3rd grade are 13% more likely to go to college. And if they have 2, then they are 32% more likely to go to college. To do this, we are going to work with our higher education systems, especially Kentucky's historical Black colleges and universities like Kentucky State and Simmons College, to recruit tomorrow's nation builders. The Kentucky Department of Education has already begun this work, and we will continue to leverage these programs to find a group of diverse young people who aspire to transform their community through teaching. The Go Teach KY program is recruiting the next generation of teachers in the Commonwealth with the mission to ensure that all Kentucky students have equitable access to effective teachers. And the Kentucky Academy for Equity in Teaching is a loan forgiveness program designed to identify and prepare effective, experienced, and diverse public educators from across the Commonwealth. The Beshear-Coleman administration has been committed to lifting up the voice of all Kentuckians. The voices of the next generation should be no exception. They deserve leaders who listen, and they deserve leaders who look like them. And today's actions move us closer to that reality.
In the coming days and weeks, we will be announcing additional steps that we work with the leaders in these communities to develop. Certainly, economic steps and investment are absolutely necessary. One that we're already working on is the potential for almost 1,100 jobs with a new MCO that is committed to putting their headquarters in West Louisville. Now, we have enough time if we can use our workforce development dollars the right way to provide that type of training in that community to try to make sure that as many of those 1,100 new jobs go to people inside the community, that we can start trying to build wealth and not just bring outside opportunities in. This is a historic time. It is a historic time in the demands that we are seeing for justice and equality. It's a historic time because already with what was happening with COVID, the world was going to be different afterwards, and the United States was going to be different afterwards, and Kentucky was going to be different afterwards. And now, our commitment is to make sure it's not just different from a public health perspective, but it is truly different from an equality and a justice perspective. This is the time where we have the opportunity to be better people, create a better world, and create a better Kentucky. These are just a few steps that we think are going to help us get there. So with that, we'll go into our COVID update for the day. And you'll see that both Sunday and Monday's numbers are down. We had seen increased numbers, and we believe that while our positivity rate is still very low, that certainly the extra contacts that people have, maybe getting out for Memorial Day and other extra contacts, is creating more cases. Now, those cases are still in a certain range that is manageable, but we will have to be watching what happens as that continues. And so we still don't have enough data from the last several days to have a full conclusion. But to give you an idea of just how much testing is out there that these numbers come from, every week since May 11th, we've had over 40,000 tests conducted in that week in the Commonwealth. And that is very significant from where we've come from. Now, the serology versus other types of tests is broken down on our website. They are both included in that set of numbers. But as we sit here this week, I believe last week's positivity rate was about 2.93% during the week, which was up from about 2.56% the week before that. So again, a lot of numbers, a lot of things we look at. One set of numbers that we now look at significantly is the ICU and the hospitalization rate. So with that, and I want to give Sunday and Monday's rates separately, and I know we're trying to not announce them during the weekend, but sometimes they just get clumped together. They are different days that are reported. So Sunday's report is one of the lowest numbers that we have seen, with 70 new cases. And those are 70 cases, 23 of which come from Fayette County, 15 from Jefferson, 12 from Warren, 4 from Kenton, 3 from Boone, 2 from Woodford, and 1 from Butler, Campbell, Clark, Clay, Franklin, Fulton, Harlan, Laurel, Logan, Muhlenberg, and Ohio counties. That brought, at least at the end of Sunday, our total number of cases to 11,356. We also had one death on Sunday, and while so much lower than what we have been reporting in the last several days, and for that we're grateful. It is another family, and let's make sure that we don't treat their loss differently than we have treated others. And that loss was a 51-year-old woman from Davis County. Let's ensure that we keep her and her family in our thoughts. Monday's numbers, today's numbers, are also lower than we've had in a little while, with 120 new cases of COVID-19. That brings our total state cases that we're reporting to 11,476. Of those, 264 are probable, and the rest are lab confirmed. Those new cases, 46 from Jefferson, and when we look back at the numbers, a significant portion of the new cases we're seeing out there are Jefferson County. 25 from Fayette, 5 from Kenton, 4 from Grant, 3 from Allen, Boone, Franklin, Harlan, Ohio, Shelby, and Warren, and 2 from Barron, Bourbon, Davis, Edmondson, Madison, Monroe, Oldham, Campbell, Clay, Logan, Mason, and Scott. And then today we lost one additional individual, which again is so much lower than what we've been seeing, but again is a loss for that family. This 66-year-old man from Hardin County. So these two individuals that we've lost, along with those on Saturday that were announced, in the press release, let's make sure we show them that same compassion for their pain. Let's keep lighting our homes and our facilities and everything else up green. Let's make sure that we continue to show all of our fellow human beings who are in pain or have been treated unjustly the type of compassion that we have been showing during COVID-19. When we look at the breakdown on race and ethnicity, on overall cases, on race, 72.53% white, 15.68% Black or African American, 6% multiracial, 5.36% Asian. And on ethnicity, it's right at about 85% non-Hispanic and 15% Hispanic. But then there's the death piece, which is one of the driving reasons that we had to make the announcement, and we've got to do so much more we did today on health care. Inequality here has resulted in death. And it's our job to do something about it. And while there are more long-term steps that we've got to take some action right now. No more waiting. Let's make sure everybody has the means to see a doctor, whether it's Medicaid or private insurance. Let's make sure everybody is reached and can get those options. So on deaths, on ethnicity, it's 96.74% non-Hispanic, 3.26% Hispanic. And then on race, 79.78% white, 16.44% Black or African American, that's double the population percentage, 2% multiracial, 1.78% Asian. Now the total number of tests now in Kentucky stands at 285,358. And folks, that's good news. We are seeing our testing now up close to the top 20 in the country, and our trajectory of new tests and staying above that 40,000 is significant. It is very significant. It means that we can meet the thresholds that people believe we need to safely reopen, but we can't have testing fatigue. I got a new test just today to make sure that I'm going through those steps that are needed to show that we cannot have that fatigue, and we have to continue to get tested on a semi-regular basis. Our total number of Kentuckians ever hospitalized, 2,368, currently 486. Ever in the ICU, 958, currently 76. This is a number we watch closely. It is fairly low. That's one where we're going to be concerned if it starts to rise and rise significantly. And our favorite number, the total number recovered, 3,359. Let's look at our long-term care facilities. Again, this is where this virus causes so much death and so much suffering. On Saturday, remember, we lost our third healthcare worker who was in long-term care facility trying to help other people. So we've had, since Thursday, this is the update since Thursday, 69 additional residents test positive, 34 staff, 7 new deaths, 1 staff member, 6 residents. 11 new facilities have at least 1 positive. But I will say, with the widespread testing that we are doing, we are, excited is not the right word, but we have had a number of facilities come back entirely negative. And right now, many of us would have thought that wouldn't be possible, but our experience with the Green River Correctional Facility shows us that if we can know everybody in a facility and whether they are positive and negative, we can take steps that can stabilize the situation and ultimately protect our people. I'm now going to ask Secretary Freelander to talk about long-term care as well as pandemic EBT.
Thank you, Governor. Today I'm here, as I have been here several days, to talk about long-term care facilities. You saw from the numbers that the governor presented that this virus really does seem to attack and go for folks who are in long-term care facilities. The governor mentioned that we had facilities that tested completely negative. That's 22% of the facilities that we have tested have come back completely negative, completely free of the virus. So, took aggressive action. And I think, as I've said to you all, I think Kentucky can stand behind the actions that we've taken. The governor was very aggressive in cutting off visitation to long-term care facilities quite early in this process. We started to stand up folks who would go in and our strike teams, and we had a long-term care group that came together and advised us very early on standards that we should put in place. At this point in time, we've tested about 30,000 residents and staff. So we think about half of the population of residents and staff we have been able to test at this point. We've tested about 129 facilities in that range, and so we have, we'll get to at least half before this week is out. We think we've been very aggressive. And rather than just test willy-nilly, we have tested and been strategic about how we test so that we make sure that facilities have a plan, because we've seen in a couple of incidences when facilities haven't had plans or when the plans haven't been robust, that those facilities have real trouble making sure that they maintain the proper number of staff. And folks have really tried very hard to do that, but we have tried to be targeted. We have tried to have a plan. We wanted to make sure that we were testing aggressively and responsibly. So last week, obviously, we have numbers that make our heart hurt around staff, around residents, and around people who have passed, who have been in facilities. But last week, we were able then to figure out the Center for Medicare and Medicaid Services, CMS, the federal government, all facilities are required to report to them. So for the first time, we've been able to see how we stack up against other states. So this slide demonstrates for you some things that we've been able to do. We are in the top 10 of the number of facilities that have been surveyed, and particularly surveyed around infection control. Our resident case rate is almost just half of the national case rate. So at 62 per 100,000, and our case rate, our resident case rate is 33, 34, much less. The death rate, again, on the nation, the average is about 27.6. Ours is less than half, 11.8. So again, you look at the numbers that you see for just Kentucky, and they do. We want those numbers to be better. But when you compare them to the nation and the national averages, Kentucky has done a good job, a very good job. And so I want folks who are watching this to know that even though we talk about those rates across the state, if you look at the national level, even if you look at the worldwide level, we have done a very aggressive and good job there. So I want that to be of some reassurance to the folks who are watching this. The other piece that I'm here to talk about, again briefly today, is what's called the pandemic EBT, or how folks can get a replacement for children who would have had meals in schools, those breakfasts and lunches that they would have had. The Kentucky Department of Education has been a fantastic partner. They've put the word out to a lot of the families that they would have otherwise served. They've helped us with our IT and data matching, and they have helped us greatly make sure that we've been able to provide outreach to these families. So just within less than a week, we have now been able to extend benefits to those folks who didn't have any other connection to the cabinet, an additional 65,000 households, and another 99,000 children who would be impacted. So we know already that we put out about $143 million in benefits. the folks who have been getting assistance through DCBS, we think we've reached almost 400,000 kids, about 360,000 kids. You can still sign up. You can sign up through the end of June. Please do so. It is fairly easy. There's the Benefind website. And then you can call, if for those who do not speak English can apply at the number that's up on the screen. So it's go to the PEBT fact page, look for DCBS COVID. There's someplace you can email if you have questions. We've answered 2,000 so far. And this is the main number that you can call to apply for benefits. Please do so. These benefits, I know folks sometimes feel like, well, I maybe don't need these benefits. These benefits not only help you, they help your community, they help your local grocer. Please sign up. We're ready and waiting for you to do so. Thank you.
All right, at this point, we will open it up for questions. We have 5 journalists with us here today and a group of questions from home. I'll try to do one and one as we move through. Lawrence, you want to kick us off?
To flesh out this program you're doing to make sure that people in African American communities have 100% health care. What does that look like?
Well, the first goal that we have is to have 100% coverage, every single individual in our African American communities, to have a form of health care coverage. That could be Medicaid, that could be private insurance if they qualify for Medicare but aren't otherwise signed up for it, but every single individual to be able to have that type of coverage. Now, there are still other issues that we got to deal with. We got to deal with access. You shouldn't have to take multiple buses to see a doctor. We'll have quality issues that we have to address. We'll have other type of societal or other issues that can lead to poor health. But the thing that we can do, maybe not immediately, but start on right this minute, that doesn't require a task force or anything else, is a direct effort by this administration to get everybody signed up for some form of coverage. And the blueprints are out there on how to do it. When a past administration launched Connect, you saw a statewide effort, and this is going to be more targeted to try to sign up as many people as possible, and we were the most successful in the country. There are multiple groups out there that have done this at different times, and here we have more interconnection, I believe, in the community we're looking to sign up than in many other places. So we're going to put money into it. We're going to put people into it. We're going to make sure that the community anchors are a big part of it, but it's time. Every individual is our goal. And I'm not going to be happy with 99.5. We're going to have to go and find those extra individuals. And we saw some of that fall off in the last 4 years statewide. Less children signed up for K-CHIP, which is the children's version of Medicaid. We're going to reverse that. But it's time for the priority in this community that I've been hearing has not been there. Let me answer one from here, asking me about the outbreak among members of the Clays Mill Baptist Church following my recommendation to avoid these types of gatherings. First, I hope that everybody that tested positive from services at Clays Mills Baptist Church has seen or talked to a doctor. Get the health care that you need. We want all of you to be okay. I think this situation, along with some others, there was one in Western Kentucky, and along with the Supreme Court decision that's backed up our authority to do it, I hope just proves to everybody that the reason that we asked people to shut down in-person services at a time when COVID was increasing, almost doubling every week, was about protecting human life. You know, I'm a person of faith. I'm a guy who goes to church when we could every single weekend, and my kids are going on Wednesday nights. It was absolutely never about, nor would it ever be about, trying to get in the way of people going to their house of worship. But what it was about is making sure that people aren't harmed when they're going to their house of worship. and I know that the pastor of this church is the one that stepped out on the front of the Capitol with the Attorney General and said, stop it, Governor, we can do this safely. Well, he couldn't. So let's just make sure that when any facility, not just a house of worship, is opened, that we are truly ready and that we take the guidance seriously. That if you were having a bunch of people come in to an inside space, you ought to be asking them to wear masks and you ought to be leading with it. You got to make sure that you have the cleaning, that people are spaced out, that you don't just give lip service to these guidelines, but you put your leadership behind it. You put your credibility behind it. Let's just make sure that these situations don't happen again. We all want to be safe, especially in our houses of worship. Tom?
Thank you, Governor. There's a local restaurateur here who wants to know when the 33% limit will be raised. So doesn't think you can see it isn't very long being able to serve more people.
The question is on restaurants and the 33% limit. Our original goal was to look at potentially raising that 1 month from the original opening, and we're still watching the numbers. If we don't see a spike, that's likely the time that we will do it. Now, the time when you can have 50 or under is also going to provide a new option for folks to where, as long as you have the space in the restaurant, it can spread people out. Once we have the 50 and under guidelines, it's going to simplify a number of things. I know our restaurants are really trying, and all I'd say is to any restaurant that's not doing everything that you should be doing, you're putting every restaurant in their capacity at risk. But I've been really impressed with how hard they're trying, with the exception of a bar or two that wasn't doing the right thing. It's been really neat to see how much they care about their customers. That goes into effect either the 28th or the 29th. 29th. Catherine, let me read one more. Have I been made aware of the sexual assault harassment allegations being made against LMPD Detective Brent Hankison on social media? I've just been informed about some of those. Any allegation of sexual harassment or sexual assault, it's important to take it seriously. We live in a world with a rape culture where nearly 1 in every 2 Kentucky women face some form of sexual violence in their lifetime. Unacceptable. And part of the better world we're trying to build ought to be a world where people don't face that type of violence in their life. So if any of those individuals, I would think, want to speak either to certain detectives in LMPD, in the Kentucky State Police, or investigators in the Attorney General's office. I know when I was there, we did it. Certainly, any of those law enforcement officers should listen and should take it very seriously. We need a better world in so many ways, and why not now? Catherine.
Is an 8-hour online course for law enforcement on those things like implicit bias and use of force, is that enough training?
No. The question is an 8-hour course on implicit bias and racism and the rest for law enforcement enough? The answer is no. But it is a start. And it's a start that we can actually accomplish. So when we looked at what we can do and do immediately, I wanted to make sure there were things that we could get out there and get done. And obviously we're going to have longer term announcements that come up. Is an 8-hour course enough to solve every issue we see out there? No, it's not. But it's a start. And we can have other programs that build upon it. But it's a start in changing culture for all of us. I want to say that this is not just a law enforcement issue. Implicit bias and racism permeate every part of our economy. You heard about it in education, certainly in healthcare. And so in many ways, we're all going to have to figure out what our training is, how we do better moving forward. Kentucky cases are up about 25% over the last 2 weeks. The 7-day rolling average of positives is also increasing. So it doesn't appear to be just an increase in testing. Do I still feel comfortable with the reopening strategy? I do. But we are very carefully monitoring this. I mean, we just had numbers today that are down. When you look at the weekly positivity rate, it's gone up about 1% over the last 3 weeks, from 2.07 to 2.93%. Now, we are down from a 9.77% positivity rate the 4th of May. So we just want to put it all in context, but we're watching this every day. Remember when we had a 2-week decline, and we want to get back there, it took us almost a week after that to truly see it. So we're going to see more positives. We're going to see more positives because people are having more contacts. Now, I do worry that some aren't taking it as seriously as we should. I know we put out some initial guidance for review on education and opening schools. And I know at least in a couple situations, if we had 10 things, somebody said, well, we can't realistically do half of those. And just tell us it's still safe. Well, it's not. And this is a virus that we know certain things about, and we know that distance and masking work. And if people are unwilling to do those things, it makes it less safe. So the more people out there that wear masks, the safer we are. The more people that engage in social distancing, the safer we are. The more people that have decided that they're over it, that makes it harder. And separately, let me say that if you've been in a large group in the recent past, get tested for your safety and for others. Joe.
The attorney for David McAfee's family asked today that all parts of the investigation into his death become public immediately. Secretary Barron mentioned that there will be an update on that tomorrow, but is that something that you can commit to?
Well, so it's an ongoing investigation. I believe we are sharing more pieces of it more quickly than just about ever occurs in it. What I do want to make sure is as evidence is shared with the public, that it's in context. In other words, if there are multiple videos, people ought to be able to see them all together. So I want to make sure that yes, we are going to be providing evidence as we go, but if there is a piece that somebody hasn't followed up on, it may be important to present it together. Like there are multiple forms of ballistic evidence in this case. All that ballistic evidence is needed to be presented together to know what you're looking at. But our plan is to share details as we go forward. Let's see. As Confederate monuments come down both around Kentucky and around the country, I'm wondering what is my take on the Confederate Memorial in front of Callaway County Courthouse in Murray, and whether I'd consider taking executive action. I will admit that I've been focused on the Jefferson Davis statue, which I believe needs to come down in the rotunda of this Capitol. I believe it is a symbol that divides us, and it no longer, and to me it never, had a place in a rotunda that is supposed to honor people, not to show history, but to honor them. And I don't believe that another child should have to come into this Capitol and look up at a statue of someone that is rightfully seen as supporting the enslavement of some of our citizens. Shouldn't be there. And I'm not just talking about removing it. We're working on taking steps to actually get it done. I'm not familiar enough with this monument in Murray, but if it is at a courthouse, it ought to come down. That's simple. And you know what? You're seeing people march all over Kentucky that agree. And I know that might cause some disagreement for some people out there, but I told you a while ago that I'm past politics. I'm trying to do the right thing. And having a Confederate memorial, Confederate monument on courthouse grounds or in the rotunda is not the right thing. Should have done it long ago, but let's get rid of them now. Al.
Like the World Health Organization undermined the best argument for mask wearing today when it said that asymptomatic transmission was very rare. You all have any reaction to that? Any altered guidance?
The question is about new information from the World Health Organization. I haven't read it yet, but I certainly know that all of our state public health officials and every federal official. I was on the phone call today with the Vice President and Dr. Birx. Every single time are saying wear a mask and it protects people around you. So that'll be something we'll have to look at and analyze, but certainly from the way that we believe this spreads. Coughing, even asymptomatic folks coughing should be able to spread this. There's no question a mask will serve as a barrier to reduce that. And if we find out that masks aren't helpful, I don't want to ask people to wear a mask just to wear a mask. No, nobody does. But as long as I still believe this might prevent me from spreading it to somebody else whose body might not be able to handle this disease, I'm going to wear it. And even if it's in part based on faith and being my brother and sister's keeper, or faith that I know that this could at least reduce it some, it's worth it to me. Is it Nick? Back there? Nope. All right, back to Lawrence. Did I miss anybody? Okay.
Governor, the guidance for historical racing venues has not yet been posted. Why not, and when will that guidance be up if they're already open?
Well, that should be posted. It's based on a proposal that they sent to us that we okayed. So we'll need to post that. If you want to serve an open records request, we can get what that proposal is right to you. That's a public document. Tom?
The majority of members of Louisville National Council sent you a letter today in which they're going to ask you to ask the Kentucky Department of Education to take another look at the requirements for opening up. They fear, among other things, that JCPS, for example, having to deal with 3 different scenarios is really going to squander some scarce resources.
Well, our request for people to develop 3 different plans was because we don't know what the virus is going to do, and I was always taught to be prepared. That doesn't mean that you have to put tens of thousands of dollars into developing the plans. It just means you need to be thoughtful about how you're going to do it. I mean, I think it's worth spending that intellectual capital and that time if it better protects our children. We have got to be willing within our schools, if we're going to open them the way that I want our kids back in school in the fall. But if we're going to do that, we have to recognize there's a pandemic out there, and we're going to have to do some things differently. And if we fight every difference that there would be in our classrooms, then we're just ignoring the pandemic. And I would like to think in bastions of education, we would learn from the past, we would listen to the science, we would adopt the public health. And yes, if it means that people have to do things that are somewhat uncomfortable, if we have to move desks further out, if we have to change busing schedules, if that's what it takes to make it safe, then we should consider it. Now, at the end of the day, it's going to be up to each superintendent. Each superintendent closed down schools. They'll have the opportunity to open them. And what we're going to do is we're going to put out, here is the way to make it as safe as you can. It's a worldwide health pandemic, so as safe as you can. And then superintendents will have to decide which of them they're willing to do or not. That's not trying to push it back on them. They're the ultimate decision makers there. But what I'm not going to do is to say, if you won't do multiple things, you're still just as safe. No, there's no question that we can give you the steps that under our current knowledge will make it the safest. And we hope you'll take as many of them as you can and put them into practice. I want to get you those numbers directly because the uninsured rate, I know we have those numbers in our African American community. And then there's also which communities around the state and the size of those. But we'll get you that number. I want to make sure that it's accurate. Unfortunately, it's higher, I believe, than just about any other demographic, but we're going to fix that.
I have any questions. Are the ballistic tests back on the bolts that hit Ethnicity? And 2, why have no National Guardsmen who fired shots been named like the LMPD officers?
So the question on naming the National Guardsmen is with the JAG, the Judge Advocate General. because there are some different laws that come into play. We're awaiting their response to whether and how we provide those names. The ballistics, there are multiple pieces of ballistic evidence. We believe that we will have them all to present tomorrow, and that'll put all of them in context. Al?
The Kovat Now website says that from May 28th to today, the percentage of contacts traced fell from 45% to 22%, which is not very good. Are those figures accurate? And if so, what's the problem?
Yeah, the figures on Kovat Act Now in relation to contact tracing. At one point, they had us with 50 contact tracers, and we had a lot more than that. We'll give an update on the hiring. What I know we have in place is we have the hiring significantly done for the Department of Public Health. We have the regional folks, which was that second level, just about fully hired, and now they're onboarding the additional contact tracers throughout the state. I believe that we're better than what Kovat Act Now is saying. Now, are we where we need to be? No, we're not. We still have a lot of work to do there. I was a little worried that a number of members of the General Assembly just said they didn't think it'd work at all. Well, the White House says we have to do it. And I believe that we can. I believe there will be some instances where it's easier than others. Certainly, the tracing, say, through the Clays Mill incident, you certainly can determine who else was at that meeting and then trace those individuals. Sure.
Afraid they're going to hear complaints from their constituents about contact tracing.
I don't know exactly what's driving the legislators that voice those issues. All I know is that we have the White House, we have federal health experts, you have the governor's office, you have state health experts that all say that we've got to do contact tracing. Every single governor across the country is doing it now. So I don't know why we'd throw criticism out there from something that on all levels we say we need, and it's been done in the past. Never at something like this, but it's not new, and it's something that we just have to replicate at a much larger scale than has ever happened, admittedly. Let's try to go through one more time.
Talk about the efforts again to flesh things out, including teachers of color. What is the percentage now of African American teachers, and where do you want to get?
Let us get you those numbers. The percentage of African American teachers in the Commonwealth is far lower than the population, and way too low in all of our school systems. It's incredibly important that our students, especially our students of color, have teachers that look like them and share some of their experiences. And the numbers on attainment, I'll say that we need to be making major investments in this, and it could be transformational, but this is everywhere. It's in our state government. We'll be providing a report in the future on that, where I believe we are doing much better, but we have a long way to go. It's in so many of our contractors of different types across the state that we do business with, and we got to do better there, making sure more dollars are going to minority contractors, and when you get points on bidding on a contract for a minority contractor, that they're actually a part of the project and not just being listed. So it's time, and I'm committed. My administration is going to do everything we reasonably can to try to create the better world that's being demanded out there. Tom.
Governor, Congressman Comer said today on a radio station in his district that Kentucky needs to open up businesses entirely immediately because there are businesses not in his area are getting killed by Tennessee.
If Congressman Comer thinks opening all businesses right now is a good idea, I think public health disagrees. His real fight there is with Donald Trump, whose administration put out a plan that, with where Kentucky is right now, would not approve of that. So if he'd like to argue with Dr. Birx or Dr. Fauci or the White House itself, he can feel free. Catherine.
Kentucky has criticized you for attending that rally on Friday, speaking at that rally on Friday, and while your guidance has been to keep gatherings small still, how do you support us to, how would you respond to that?
Well, I don't worry too much when the opposing political party, the organization itself, attacks me. That's their job. That's what they do. Now, on Friday, we had 1,500 young people march in Frankfurt. I think that'd make it one of the 15 largest marches that we've ever seen here. Out there demanding change and demanding a better world. And even with the health concerns, I thought this moment in time, it was important to be there. And for those individuals, it was important to talk to them. It was pretty incredible to see a whole generation demanding something better, but also, as I saw and when I went out, having some faith that maybe I can be just a small part of doing it. Now, everybody who's in one of these marches, please go get tested. It's a smart thing to do, and we want to keep you healthy. But there are some moments in time where, even though it was a personal safety issue, when you look at healthcare, it's important to be there. That's what I wanted to do.
The administration closer to an answer on whether fans can attend Kentucky Derby in September?
Oh, we are not at this point, and we haven't seen what the plan would be and how many there would be. Churchill hasn't gotten back with us on that specific one yet. I know they're working on some other pieces as they're moving forward. All right, Al, take us home.
Regarding the possible reasons for the uptick of the last week or 10 days that could have been related to Memorial Day, but really there wasn't that much incubation time. Isn't perhaps Mother's Day and the beginning of churches and the beginning of reopening, May 10th and 11th, likely the starting point for what's been showed up in the numbers last week?
I don't think there's any question that the more we open up, and every time we've opened up, we're going to see some more cases. And we've prepared for that. One of the reasons that we had to flatten the curve is so that we have the healthcare capacity to help people as this virus moves through our population. But yes, every time we open something up, it creates the opportunity for the virus to spread. And where we're at right now, looking at just our overall number of cases, probably isn't the most important analysis. It's whether when people get it, how sick are they getting? Are we providing them the treatment? Do we have the ICU capacity? We're at that point where we've got to restart our economy, which means we got to take care of people. And when that ICU number, if it does significantly go up, then we're really going to have to, that's when we really have to look at things.
As a follow-up, have you essentially decided that we're going to have to live with a certain number of cases day by day for the foreseeable future?
Well, until we have a vaccine, the virus is going to spread at least a certain amount. Even when we were healthy at home and limiting our contacts, we still had 100 something cases, about what we have today. I think it'll be really hard for us to get under that number in the near future. And as long as we are taking care of people, as long as we are protecting our long-term care facilities, which we really need to, as long as we're ensuring there's not an outbreak like there was at Green River, which is stabilized, and we are happy about that, and Western State, which is stabilized, then we got an opportunity to reopen our economy while dealing with this virus. The virus doesn't go away, so there are going to be cases that spread throughout us. Let's make sure we know the signs, we're willing to quarantine when we have to, and we go see a doctor when we need to. Separately, Dr. Stack made sure to remind me, if you have been putting off necessary medical procedures or checkups, we need you to be healthy. If you put off your kids' vaccinations, now is the time to go back and get them. Let's make sure that as we come out of this, we do the things to be healthy enough to deal with this virus if we potentially get it, and that we don't succumb to other issues. All right, folks, it is the end of the day. And again, I know it strikes me that we are at a moment in history that can change things in so many different ways. And I think if we open our hearts, we open our minds, we accept that we have a world that has had real problems in it. And then we use, whether it's our faith or our compassion, to say that it is time that we address them, that there is a lot that we can do together. 1,500 young people here right behind the Capitol, just telling us all of us, that they want a better world. I think that we all live for our kids. We all live for that next generation. So let's fulfill our commitment. Let's satisfy those demands, and let's give them the world that they deserve. Thank you all very much. Oh, sorry, we got a video to leave you with. As you know, we've got a return in July of NASCAR here in the Commonwealth up at the Kentucky Speedway. It is the 10th anniversary of it, so they sent a message to leave us with.
All right, Kentucky! Drivers, start your engine!
NASCAR is pleased and excited to announce the 2020 schedule for the annual July weekend at Kentucky Speedway. The weekend commences with the NASCAR Xfinity Series Kentucky 200. That's Thursday, July 9th on Fox Sports 1. Friday, July 10th features the Xfinity Series Alsco 300, also on Fox Sports 1. The NASCAR Gander RV and Outdoor Truck Series, buckle up in your Truck 225, Saturday the 11th on Fox Sports 1. And the highlight of the weekend, the 10th edition of the NASCAR Cup Series Quaker State 400 presented by Walmart, Sunday, July 12th on Fox Sports 1. NASCAR and Kentucky Speedway, a bluegrass tradition.